discussing intravesical therapy, do's and don'ts, practical tips, and myths. Beverly graduated from McGill School of Nursing in, it says 1992, Beverly. She worked in Montreal General Hospital's urology outpatient clinic since 2000, and where the main focus of practice is urologic oncology. Beverly completed a postgrad course from Masters University as a nurse continence advisor in 2003. Beverly.
So I'm not sure if, hi. Gênez-vous pas de vous parler en français, je suis bilingue, je peux parler dans les deux langues, mais je vais faire ma présentation en anglais parce que ça va être un petit peu plus facile pour moi. So yes, I'm at the Montreal General. We've been working there actually in urology since 1996. But regularly since 2000. We do give a lot of intravesical therapy. Intravesical therapy means treatment in the bladder. This can be one of several treatments, most commonly BCG, Bacillus calmette-guérin, which you've all heard several times and many of you have received. We also give epirubicin, mitomycin, and as a few of you also know, BCG plus interferon. Next. So I thought this would be fun to put it in question format. Test your knowledge. Many of you should know the answers to these questions. So my doctor told me everything looks good, but he wants me to have more treatments. Am I really doing well? This is the most commonly asked question I get when I see people back for their first maintenance therapy. So the answer is true. As Dr. Sad touched upon, BCG takes a long time. We give 6 inductions. 6 inductions. Ça veut dire 6 traitements en ligne, 1 par semaine. There is now a delay of 3 months, followed by 3 more, another 3 months, 3 more, 6 months, 3 more, 6 months, 3 more. So there you go. 3, 6, 12, 18, and 24 months following initial therapy. Yes, I get to know my patients. Next. I'm having a lot of side effects. This must mean the treatment is working, right? There's got to be a payoff somewhere. I don't know, people? They looked? Go. False. What happens, your side effects, has absolutely no indication on how you are going to respond to your BCG. It is merely a reflection of how you are responding to this medication, whether or not it's having a big impact on you. So unfortunately, even though you might be suffering a little bit, it doesn't mean that there's a good payoff at the end. Next. Adverse effects will increase the more treatments I do. Studies show that this is not necessarily true. This is not a fait accompli. By and large, most people will go through all the treatments, all 24, and there will be variance. Sometimes there will be a treatment that they really suffer, and then the next week, geez, no problem. We do see some people who develop BCG intolerance. Now, BCG intolerance means that, yes, you are having cumulative effects from the treatment. These are the people that we do sometimes have to stop. But by and large, that is not a true statement. That is not a fait accompli. It does not mean every treatment you can expect it to be worse. Does it happen sometimes? Yes. But it's not absolute. Next. I have no trouble holding the treatment for 2 hours, so if I hold it longer, it'll work better. 2 hours? False. Very false. 2 hours is our maximum. Maximum. I stress that a lot. if any of you, those of you who know me know. 2 hours is the max. The first hour is the most important hour. So for those of you who only hold it for 1 hour, you're still getting the benefit of the treatment. It's still worthwhile. But certainly more than 2 hours will often result in more severe adverse effects afterwards, so it's certainly not worth it. I should drink plenty of water after my treatment to help reduce the burning and the frequency. True. It's a little counterintuitive. C'est pas vraiment évident. Pour soulager la fréquence urinaire, il faut boire plus. How can that be? Well, it's like anything. You have to think about what your bladder is going through. We're putting something that it's not happy to receive. This is something that is going to produce an immunological response and inflammation in your bladder. You're going to want to urinate more often. Your bladder, the cells in the bladder are not terribly happy. They are there to protect the tissue underneath from the corrosive, if you want to call it, effects of urine. Therefore, a dilute urine is less bothersome. So, your burning will be decreased. Your overall frequency, believe it or not, will be decreased. I encourage 2 liters of water starting after the treatment, usually starting about an hour and a half after the treatment was received. Not the 2 hours. I don't ask patients to wait until the 2 hours is up because you are a little bit dehydrated, you have not been drinking prior to your procedure, you're not producing much urine. We want to start the process before. So we start drinking after 90 minutes, void after 2 hours. You'll be happier the rest of the day. I must lay down and turn every 15 minutes to ensure the treatment is well distributed. You're all saying true. I don't tell you that. There's a little 3-letter word thrown in. You may. You may lie down. The key about this is to remember that immobility is discouraged. We only know this from studies done years ago with BCG given to non-ambulatory patients. These were patients who were in effect, for the most part, bedridden. They were left lying for 2 hours until the BCG was drained. What we saw was a greater effect on the back side of the bladder than on the outside of the bladder. So we know there's a gravitational component involved. So for people with less ambulation, I do encourage them to lie down and to turn because they're not going to go home and vacuum. Okay? And they're not going to go out for a brisk walk. Certainly, you may go home and lie down, in which case you must turn every 15 minutes. The literature does support this, but what it supports is the actual rotation of the bladder. There's nothing that says you have to be lying down to do this. So it's your choice. Word to the wise, I have had patients go home, lie down, and fall asleep. What do you think happened? Remember the previous slide? More than 2 hours? Yes, they suffered. They suffered a lot. So I leave it, really, it's left to the patient's discretion how they want to handle this. There is a benefit to the rotation factor, but this can be accomplished by the ambulatory patient by simply being very active and moving around. Just so you know, in the literature, in the actual recommendations in the different products from the different companies, they can't even agree on it. So, just so you know. A rash means I'm allergic to BCG. False. You got that one. A rash, particularly more commonly on the arms and legs and occasionally on the trunk, is one of the adverse events that we see fairly regularly. It's not indicative of an allergic reaction, and it's not a good enough reason to stop. My arthritis seems to flare up when I receive BCG treatments. Anybody? True. BCG invokes an inflammatory response. Arthritis is an inflammatory disease. So most patients who already have arthritis will report that during their treatments, they suffer from that too, as if we weren't making them suffer enough already. Not everybody gets this, but certainly a lot of people do, and some people in particular. So is it your imagination? No, it's not. It's really happening. It'll stop. So these are some tidbits that I got from a certain study that did a synopsis of reviews done in the US. And I found them rather interesting, so I thought we could look at that. Studies have shown that 30 to 50% of patients stop BCG without medical cause or reason. Anybody think that's true? According to the study I read, it's true. Again, this is a US study. I don't think it's reflective of what we do, certainly, at the General. But apparently, a lot of people do stop their treatments. Pardon me? That might be the cause. That's absolutely right. Unfortunately, a lot of people don't have healthcare insurance, and so that might be the reason why that number is so high in the US compared to Canada. Yay for free healthcare. About 30% of patients develop low-grade fever following a 30... Now, I think you all get this right. Very true. So I actually think it's a little bit higher, but that's what the study reported. I think anybody who's had BCG, most of you at some point report feeling very cold after your treatment, so we do see that quite a bit. Some medical centers report only 16% of their patients complete the full course of BCG. Absolutely true. Again, this was a review based on US centers, not Canadian, and that's absolutely frightening. Although they did cite that patients a lot of them stop due to side effects. They did not cite anything about cost, but I think that's a very interesting point that you brought up. That was an interesting point as well back there. It did cite that a lot of doctors were responsible for stopping their patients' treatments. And believe it or not, the reason cited was to protect them from severe adverse events. And again, if we look at the literature, adverse events do not... So if you're stopping the patient before the adverse events actually happen, are you actually protecting this patient from adverse events? When in fact the literature suggests that it's not a fait accompli that they're going to get worse with time. So, the point of my talk, because we're talking about therapy, and again these are for more high-risk tumors. These are tumors that are what we would call high-grade superficial. They can be singular and more often multifocal tumors, meaning there are many, or what we call high risk, meaning they were pretty darn close to the muscle layer of the bladder. The point of this is that the treatments are very important. Water. Bladder cancer patients need to drink water. Your bladder will only be as happy as what you ingest. I was very happy to see decaffeinated coffee here tonight. I spend a lot of my time discouraging or convincing patients to reduce their caffeine intake. They complain of symptoms they're not willing to do anything about. Water is so important. The bladder will react to whatever you pour into it. Different things we eat and drink do get passed and processed through the bladder in the urine. Anyone who's eaten asparagus will know this. Okay, so water. Tylenol. I love Tylenol. Why are people so afraid to take Tylenol? I have a patient say, yes, I felt really cold, so I took a Tylenol. One? You're teasing it. Please take the recommended dosage. That's 2 to 3 tablets of regular Tylenol for an adult. Otherwise, you're not really doing anything. Take it. Take it again after 4 hours. You'll go through your treatments a little bit happier. Anticholinergics. People who are having a lot of frequency, running to the bathroom, having trouble, we need to give them these pills. We have these pills. We can give you these pills. We need you to be happy. We need you to get through your treatments. Think of these pills as little sleeping pills for the bladder. They'll give you more time in between urination. They'll hopefully give you time to get to the bathroom. Anti-inflammatories. Advil goes a long way. Again, very helpful with any aches and pains you're feeling due to that inflammatory response from the treatment. Unless you're not allowed to take it, it's a great drug to take while you're getting your treatments. Reduced dose BCG. If you're not handling your BCG, we can reduce the dose to 1/2 or 1/3. We know that 1/3 dose, in most cases, especially for less complicated tumors, is just as effective as giving a full dose BCG. Believe it or not, we don't really know what the optimal dose of BCG is. We don't know that 50 milligrams is the be-all, end-all dose. The jury is still out on this. We use it, this is sort of our go-to happy, yes, this is what we're using, this is what we're going to stay with. We really don't know that this is the best dose yet. There's still research being done on this. So reduced dose BCG is certainly possible and not a problem. So my message is, we can help. Again, you need to talk to us. You need to be honest about your symptoms. Do not downplay them. Do not exaggerate them. Tell us exactly what you're going through. We need to get you through your treatments. We need to get as many treatments in you as we can. We know that people who have done only 6 treatments have far more chance of recurrence than people who were able to continue on maintenance. It's important. We're in this together, and we're here to help.
Thank you. Beverly, hold on. Bev, come back. Bev, come back. Beverly, come back. You were too fast.
Thank you very, very much. Much appreciated.
Thank you for coming from Toronto.
It's good in Montreal. We like it, right? Yeah. Nice and, yes, it is very warm today. We can say that today anyway.